presenting.
Mark, Jim, Kurt. Welcome to September. It is Indian, Native American, Indigenous, First Nations summer. And yet we are here. We are not outside soaking up the photons. So give yourselves a hand. We are very excited to welcome the Allen Law Group as our new sponsor for the rest of the year. And representing Allen is Sean Murray. Sean.
Right here. Thank you all. I'm Sean Farrell. I'm an attorney with the Allen Law Group. We're very excited about the sponsorship. Thank you all for the warm welcome. I hope to meet everyone and spend some more time hearing how we can help and collaborate and support. And thank you so much, David.
Sean, we appreciate you. We appreciate TAP Law as well. The sponsor campaign is in full swing for 2026. If you think there are within your circle folks who need to be in part of our circle, approach Michaela or I and let us know. And the reason we bring this up is because, of course, we are all accredited investors. We value deal flow, engagement, and integrity, but we're the only ones making it happen. There is, I know it looks like there's this amazing machine behind us whose name is Michaela. But it doesn't work without us doing the scouting and the screening, which produced an amazing program today. The diligence, which is so thick right now. We have 3 currently in diligence and 3 coming out, and we have investor calls out for it. I think that's a record for this group. And then the premiums that we talked about last month. Who from Pointe Angels was not here last month? Hands. Luke, I've got one for you, and another one for you, Dave. The challenge, Doug, the challenge that we faced in sustainability was that the premium-based model couldn't face the kind of drought that we saw in first quarter of this year. So we had our town hall meeting in July, we rolled out in August, and now we're kind of in the evangelizing phase of this tweak, this slight course correction to the operating model, which is based on investment premiums. The fall angel season is upon us. Buckle up. Beginning next week, a week from today, where I will see a lot of you back in Ann Arbor at the Celebrate Innovation reception. And the Distinguished Innovator of the Year award is going to Dr. Zhang. Dr. Zhang invented the material that is used by M3D to do its magic in gamma ray detection and intraoperative imaging. So that's Dr. Zhang, and that is the very first prototype intraoperative imagers that M3D has had, that they just had delivered. Now the significance of the Distinguished University Innovator Award, let's just go back a few years here. So Farnham Jahanian, everybody knows Farnham, right? Farnham started a little company called Arbor Networks, which was acquired by Tektronix, and then it was acquired by Danaher. It is now called NetScout. His second in command was his student, Doug Song. That company and Doug's subsequent information security companies have done very well on innovations in IT and cybersecurity. Vic Strecker won the following year. He had a $150 million exit with Health Media to Johnson & Johnson. Stephen Forrest won the following year. He invented OLEDs. Everybody has one in their pocket. That patent was not spun out in a startup. It was licensed straight out by Samsung. David Blau won the following year. Blau had an IPO in July for Ambic Semiconductor, raised $500 million. And his technology is also behind the Pointe Angels portfolio company CubeWorks. So holders of CubeWorks, you've got a piece of that. And then, of course, last year was the Histosonics team with a $2 billion exit last month. That's what a distinguished university innovator does. And we have the innovation in M3D that Dr. Zhang came up with. So I hope you can come a week from today to the Celebrate Innovation reception. You're going to ask me in a minute, how do I get to learn more about this event? I'm going to answer. Following that, the Friday is the Invest 360 conference. That's all day at the golf course. Lisa McLaughlin, who I happen to see today at New Lab, is giving the keynote. Lisa left the company that she founded, which was Work at Health. Work at Health is an app for alcoholism recovery. And there's pitch competitions in 3 different tracks at Invest 360. That's a room very much like this one. But the Michigan Startup Capital Summit, which used to be called the Angel Summit, that's the following Tuesday, and Tuesday is kind of like a train wreck. There is so much going on Tuesday. The Walsh Angels Health Innovation Pitch is that morning at TechTown. The Manutech Innovation Group is at Novi all day. The Angel Summit all day in Ann Arbor. And then we've got the On Demo Day reception and jam session that evening. So that's why I say Angel season is upon us. Buckle up. I'm getting nods from Kelly. How many of those are you going to?
A lot of them, yeah.
Yeah, so we'll have pitches from Atterex. Atterex makes an antibacterial bacteria. So not an antibiotic, but a bacteria that eats other bacteria, particularly the ones that cause UTIs. Lutely, if you've ever talked to me about Lutely, I just gush. This is a great musicians and compositional tool that is delivered in app form. So the AI is in the cloud, but the power's in your hand. And then Maka, which produces playlists for curated content for kids, playlists of parent-safe content, or kid-safe. It is parent-safe too. On demo day is the following day, so those are the pre-parties, and then who else is, Joe, I know you're going on demo day, Luke, Kristen, Kurt, so the companies that you meet we're all scouts. We all do the scouting. So if you see one that belongs in deal flow, make sure that Michaela gets them honored here. So that's all afternoon with one-to-one matchups. And then who's telling me there's a party that evening?
There's biosocial.
The biosocial, yeah. I just am gonna have to buckle up. So then 4 different pitch me competitions. Last year there was a single pitch me at the train station. This year they're spreading it around Detroit, Ann Arbor, Kalamazoo, Grand Rapids, and Traverse City with different tracks in every city, one after another, and I'm judging the Ann Arbor one. So go to pointeangels.com/fall to download all of this and a bunch of other stuff that I don't even have time to talk about that's going on in Grand Rapids and the Ann Arbor crowd. Angel season is upon us. But lest we forget, we're here as angels to see these 6 companies present. Very excited to have the referral from our friends at BAMCO. This is an interesting referral because we met BAMCO through Vessel, the prosthetics company that's also a Pointe Angels portfolio company. And Vessel refers Reya to BAMCO, and then BAMCO refers them to us. So without further ado, I'd like to introduce Dallas, and she can tell you more about Reya Health. And I'm going to set a timer right there, 5 minutes.
Awesome, thank you.
And that's what it sounds like.
Okay. Hi everyone, my name is Dallas Barnes, and I am the founder and CEO of Reya Health. It's such a pleasure to be here. Thank you, Pointe Angels, for having this foreign Canadian amongst your midst tonight. Reya Health is a medication matching tool and side effect and hormonal symptom tracker for contraceptives. When I was in university, I really struggled to find a birth control option that worked with my body, my needs, and my lifestyle. I was actually admitted to the hospital twice because of adverse reactions to my birth control. I went through the grueling trial and error process that so many women go through when trying to find a birth control option that's the right fit for them. Actually, 75% of women who use birth control describe their experience negatively. We're seeing the highest rates ever of unplanned pregnancies and STIs across North America. Nearly 50% of all Gen Z females actually report stopping their use of birth control altogether because of side effects. And yet, nearly 50% of all pregnancies in North America are unplanned. And so, I teamed up with a group of medical professionals, a gynecologist, a family physician, and a naturopath to create the comprehensive methodology behind Reya's matching, our birth control matching, and our side effect and symptom tracking tool. We sell through employee health and dental plans, student health and dental plans, and insurance carriers. And since being in market, we've actually noticed our market expanding. We're finding that women postpartum are starting to turn to the platform as part of their get back to work plan. One mother actually shared with us that Reya was monumental in her ability to focus on her and her baby's health while not interfering with breastfeeding so that she could focus on them before expanding their family. Women premenopausal and perimenopausal are also starting to utilize the platform because oftentimes women are prescribed contraceptives to help manage those hormonal changes. We launched with our first employer benefit just at the beginning of July, and we're already seeing above industry average utilization rates. People are loving the Reya app. We have a 95% user satisfaction rate. What we're finding is that when people use the birth control option that's the right fit for them, they're more likely to continue to use it and use that option properly. What this does for the employer is it keeps their premiums low. So there's less prescription switching on their drug plans, and there's less claims being made in multiple other health categories. This is good for the insurance carrier because it supports claims consistency, data predictability, and it's a part of their cost containment strategy and retention strategy. So when employer premiums are low, they're not switching and shopping around to different insurance carriers. What we're building here is a data moat around Reya Health. The data and information that we are building is really our strategic value driver and our secret sauce. SelectPath, one of our employee benefit plans, is so pleased with the success of Reya Health amongst their team that they're actually turning to their insurance carrier and asking the insurance carrier to roll this out across their business arm. This would be a fantastic revenue opportunity for Reya Health and exposure because this would expose us to hundreds of thousands of users, and we charge on a per user or per life model in insurance speak. This particular benefit plan has a track record of doing this. Last year they did this same model with a substance abuse platform, and now that substance abuse platform is rolled out across that same insurance carrier and is exposed to hundreds of thousands of users. What's next for us is focusing on increasing our recurring revenue to hit profitability, our profitability goal this year, as well as expanding internationally, beginning with the US in 2026, as this is a massive global problem. We're currently fundraising $500,000 to scale our proven and validated sales process and go-to-market strategy. We already have 4 investors committed, and we're seeing strong activity around our raise right now, so I do expect to close in the coming weeks. I'm sure I'm running out of time shortly here, but I would be happy to answer any other questions and share more about the incredible traction we're having right now around our white label pilots with digital pharmacies, as well as our most recent pilot secured today with one of the major insurance carriers in Canada. Today.
Woo!
So, thank you so much. Thank you.
Thank you, Dallas.
Thanks so much.
We met Liminal, which is solving a very pressing problem that I myself have experienced in research. We met them as a referral from our partners at RollTac Ventures. Oh, thank you.
I had lots of time on it.
Yeah. At Roll Tech Ventures, who came, I think they were referred this from the National Science Foundation's I-Core program. So that's two really nice afterburners for Liminal, which scored very well in our screening team. Please welcome Dan Deemer and Liminal. Hitting the down button advances the sound. All right, 15 minutes and 15 minutes of Q&A. Oh, you'd already did.
Hi, well, good evening, everybody. My name is Dan Deemer, and today I'll be talking about an opportunity to solve a major pain point for the roughly 1 million scientists today in academia that are really dealing with issues in data recording and in their research, especially around this explosion of like big data and supercomputing in academia. All right. So we're in academia. That's our customer. So back in the 80s, everything you did can go into a paper and pencil notebook, right? And there's a lot less data. You can smoke your cigarette while you're doing your research. Things were generally better. But now you can't do that. There's a lot more machines. Like the machines in these labs are crazy. There's a lot more people and communicating. And most importantly, the data is insanely huge. That right there, on the bottom left, that's a high-performance computing center that you find at every single R1 university, and hundreds of thousands of these are popping up. That is the new way that people are doing research. This allows researchers and my customers to store hundreds of terabytes of data and do unprecedented things with all that research. The problem is, though, like David said, we got selected by the NSF. They gave me $50,000 and said simply figure out what are the biggest issues in academic research right now. I had a lot of complaints offhand, but what we found from several hundred interviews is that note-taking is taking a very, very long time. People are having a hard time transitioning from paper and pencil and even smaller levels of data to how do you write about hundreds of terabytes of data and log everything you're doing. So it's not only taking a lot of time, it's a huge headache. And a lot of these notes are sloppy, they miss important points, and so on. I'm going to skip that because I want to. So what we found is that this is creating this epidemic of this reproducibility epidemic in academic research that you can read about. A lot of people complain about it. What it's doing is it's causing a lot of pressure on my customers because at the top level, these funding agencies, they're seeing that about 3 out of 4 research dollars are truly going to waste. And I can talk about that more later. And now they're saying, hey, we're done dealing with this. We need better data standards and guidelines. So what are our customers doing? So they're kind of Frankensteining a solution. There's no household name in academic science for like note recording on these supercomputers and with big data, right? So there's notes in all these different locations. People are sharing big data in really weird ways that you shouldn't be. And ultimately, the slice of pie for a scientist and academic, it's the amount of research time they're doing is getting reduced. And now they're doing things that they really don't like doing, like organizing data, recording it, so on and so forth. So there's a lot of room for improvement and giving them time back. All right, so our first problem. So command line tools, these are cool tools when you use these supercomputers that are becoming like present in every single university. That dominates the way that we do research. So people who use like Excel, you can't really open up like 10 million lines and then start making your formulas, right? We have to interact with this data slightly different, and a lot of these scientists are dealing with that, and they miss a lot of the record keeping behind that. So anyways, we found that the largest source of missed data capture is on these supercomputers, and it's really time consuming to record them. So look, we're introducing Liminal. Our whole thing is we are going to be a suite of zero-effort AI integration and recording tools. So our first tool that we have, it's on market. We've made some money with it. Is we capture everything that's on these supercomputers. We use AI as a translator to take all these complex logs that people are ignoring, people don't find important because they don't need to. They come back 6 months later to write the paper, and there's all this missing data, but we pick up on everything, and we use AI to create these notebooks. And kind of like Instagram or Facebook, we create these real-time activity logs, activity feeds, where people can see like everything that everyone's doing. These are going to show you. So right here, this is how people interact with their big data right now. And there's thousands and thousands of people who do this in these computing centers. This is Liminal. We track real time every keyboard click, every mouse button that they're doing, and we automatically generate these notebook entries. So one of my customers at like Colorado State, they send an email to the collaborator at Harvard. They say, hey, I need to know, what have you done with this data so I can do the next part? They wait like 2 days like a real academic, and they say, oh yeah, here's what we have. Okay, but I also want to know this. And then the other collaborator at Baylor, these are real customers, comes, okay, well what about this? Everyone just goes on, and I can see everything that everyone has done. I waste no time. The other thing is, I don't change any way I work, but now I have the value of this notebook entry. I'm a computational biologist, and I stopped writing any notebooks, like probably about a year ago. And it saves me 2 to 4 hours every week that I'm doing research. Because I know that I'm having a perfect recall notebook waiting for me whenever I need it. All right, so here's an example of like one of the notebooks, what they look like. But basically, we're just simply saving the scientists hours every week from having to worry about writing their own notebook entries, organizing, accessing. You can fuzzy search all of this, figure out what did I do 6 months ago that sounded like RNA, and then you can find everything you did. And then you can share it with just one click. It's actually pretty simple. Anyways, the traction. So, let me go up one. We've made about $15,000 in revenue with a really modest marketing effort. I mean, it's not really it's like me posting on LinkedIn and then regretting it the next day. But we've gotten these users, and I'm finding people like all over the world are just signing up. So, right now, I'm working with Oakland University to get all the data and all the computing power on premise, so I have no data or compute costs with any of this. And I can get everybody on their whole school at once access. I'm also working with Michigan State about how do we get all 2,400 of those students access to this. So what we're trying to do is be this companion tool with these supercomputing centers. Like every time you get one, you've got Liminal to have the perfect notebook entries. External traction, at the same time, all these funding agencies, they're saying, hey, we need better solutions for cheaper, and then cheaper. And the most profound thing too is like, these big data and supercomputing is not going to go away. And there's hundreds and thousands of these centers popping up everywhere. This is like the way that we do research now. And I'm gonna be honest, it'd be really hard for me to like log everything on that computer, everything on your computer, all this stuff. But people are literally converging on to these supercomputers in the thousands, which allows us to have really thin software to intercept that and then provide them this value. So the timing of this is pretty key. All right, so there's about 1 million shell, or that's because that's how you interact with these supercomputers, shell users in the US right now. We've already got 2 other integrations planned. So what we're trying to do is take this slice of the pie that these academics are doing, okay, everything on the research computers. Now what about, how can we incorporate all of their work, be like the gold standard for, in the background, don't change any of your work, but everything's being recorded perfectly with perfect recall. So these are our next integrations. And then globally, this market, I always have to like check the numbers, but the market's just expanding wildly. So for anybody who's kind of worried about selling ed tech, I had previously sold like a bulky solution, and it was a headache to go with the sales and talk to people and the support. That's why with this, we slimmed down everything and made it super academic friendly. That's our beachhead sort of market, and then eventually there's no reason we can't expand the industry. But yeah, I mean the stuff like on-premise hosting, like what is happening is, it skipped one. This is next. Anyways, so right now we're finding that I think there was something missing here, but basically it's costing us like 90 cents a person to go ahead and have them use the app. And I don't support anybody. I get like a notification that someone signed up and then they're good to go. So our go-to-market, this has been heavily researched. Basically, it took me a while, but the beautiful thing about academia is everybody's title is online. They're pretty accessible, and there's these research administrators that take control of the whole, IT for the university, and they have the decision-making power to onboard, the couple thousand people that use these supercomputers at the university at once. So I'm mainly focusing on, university-wide onboarding at this point, but I'm gonna just kind of skip. I do not want to discount how awesome selling to academic research is, because this is a network diagram with some like extra fluff in the background, but basically this is one modest lab at Purdue, and how intertwined they are with all these other labs. If you do like two nodes away from a collaboration, it's like hundreds of universities are connected to these researchers. So we're finding that like my customer at Purdue, they're working with somebody at Baylor, like they get a lot more value if both of them are using it. And what's cool for me is that now Baylor wants somebody from Iowa to use it. They sign up, I don't train them, I don't onboard them, they just get the value. And they don't change any of their work, it's just now, you've got fair, compliant notebook entries. But, so, let's see here. Yeah, also heavily researched, super simple revenue model right now, $20 a user. Eventually we'll have tiers, I don't really know, but basically right now what we need to have is super simple price modeling. So the undergrad, the grad student, anybody in that ecosystem can come in and buy that from us. Oh, here it is. It's cost like 90 cents a person. All right, I'm gonna go through this kind of quick. But basically, I think about this in 3 milestones that we have to hit. The first is I want to focus on our couple thousand loyal subscribers. So right now I actually throttled at about 120 while we, bulk up the tech a little bit more. So I want to get to that 2,000 mark. The next is I want to, open up our other integrations. But finally, like the main point of this isn't just to be this perfect record on supercomputers. It's to be the gold standard for all of the research that's being done. So there's a lot of, room for growth of how do we expand in and become this like gold standard for, there's a supercomputing center doing research. All right, Liminal is going to be, that add-on, but also everything else that these researchers are doing. And the big difference between us and these other companies, I spent like 3 years as a lab manager trying to find a solution, and I took like extensive notes on it. It took me so long to figure out what people were even selling me. We are very different in that we're super affordable. There's no training. But most importantly, right now, out of the big players, nobody has this shell integration that can come in to Michigan State or North Carolina and say, oh yeah, here's this tool. I can plug in your compute power, plug in your data stores, you guys are good to go. Because, everyone's software is so bulky. Like what we did is we've trimmed so much off. But yeah, and also, the other thing I want to mention, I try to stay away from the scientists, what they're doing. We're trying to be this like foundational layer. So the data that we collect for them, it's not just for the notebook, but it's also nicely formatted so like they can use AI to train, whatever they want to do with their data. If they want to make protocols or they want to have like a new SOP for their students, all that stuff is right there. They can do whatever they want with what we're collecting. All right. So I've been a lab manager, I'm a developer, been at Purdue University for about 6 years, was at Lilly for a little bit before that. Steve, he's a co-founder, professor. We've worked on a lot of different company sort of consultations from like Holypop and McCormick to just dozens of other universities he's worked with. And then Maverick, he's in trouble for wearing his Apple sweatshirt here, but he quit his job at Apple about 1.5 years ago to work with us, and we all said maybe hold on, but it was actually amazing what he's been able to do for us. And that's got Nathan's been not a co-founder but just with us. So here's the numbers. The big thing I want to show is we're hoping to make about $10,000 more this year, and then next year for the units sold, like that's one enterprise deal. And I'm talking to 9 different university research computing centers, and they're slow. I gotta figure out how to speed up that process. But we're in the conversation with interested people about that. Now they ask, so they're asking for almost out of time, just under $1 million for 18 months. First 6 months, I want to just focus on the loyalty of 2,000 customers. The second 6 months, I'm looking to really drive sales and dig our heels into this process. But finally, this is all leading up to this idea of the marketplace and validating the fact of how much of this research activity we can record in the background and kind of be that household name in academia.
Make it?
Yeah,
Let me ask you a question about that exit.
Yeah.
This is the curated Q&A portion where you try to get my attention, and we want to go quantity, get lots of questions answered in 15 minutes. And my first question is, how do you exit?
Just walk, you just do.
Yeah, right. Because every company does. Right.
Yeah. So I spent some. So like, this is the major player in academic research. There's a. These are kind of like lab information management systems. They're making a lot of headway with this. They're a slightly different thing. LIMS is kind of like a derogatory term to my company because they converge people on what they can do, and they're very bulky. We just simply stay in the background and collect. So companies.
So does a LIMS end up buying it?
Yeah, they probably would, because we could be that integration. I've talked with them, and there's some other companies I've talked to, like CDD Vault, about, hey, we've got no shell and supercomputer integration. I actually was talking about them potentially taking on our software.
For an acquirer, whether they're adjacent or a competitor, to buy you, you have to solve their problem,
Yeah.
not just academics' problem. So there's discovery yet to do on this. Right.
For sure.
Luke, and then Alex.
Thank you. Thank you for being here today. So my question is around use of funds. So just $915,000. You listed out a few benchmarks, but what will you actually spend the $915,000 on in order to hit those benchmarks?
Yeah. So the main thing that we've done a lot of work with just 2 developers, and also moonlighting a lot of stuff. I'll be honest. So the main use of funds would be for developers and support, like for Liminal, like making it easier to plug into any university, and yeah, just that customer experience and working on the next integrations. Other than that, there's really not a lot to spend money on.
If you were to describe the spend is R&D.
Yeah.
How much of the 915 goes to acquiring and retaining those 2,000?
Yeah, I mean, there's going to be a significant spend on that too. Having somebody having somebody dedicated to.
Does that come out of the 915 or is that?
Yeah.
That's what I was asking.
Yeah, definitely.
All right, Alex, and then Sigurður.
So you have 120 users currently?
Yeah, and then I had to stop. I had to stop people from onboarding because we wanted to use that information to make the process even easier.
So I guess my question is, how many of those were referrals from the other scientists? Or I got a buddy, Alabama, who's neuroscientist, not in the same field, but hey, Scott, you should use this. So how many of those 120 are referrals?
Yeah,
So these guys talk to each other all day long.
Yeah, it's a good question. So there's definitely a significant portion. We've got about 60 users from managers of labs saying, hey, I want to buy it for my whole lab for the whole year. So that's like one bulk. Then we've got another smaller group of just like individuals who buy it. And then we've got this other group of maybe 30 or so who like knew somebody who used it and then did that.
So about 25% of your guys are referrals from other scientists.
Yeah, about 25%. And I will mention too, we haven't really done much marketing yet because we've been trying to stress test the system. Because people can go on and sign up without me knowing, I get like a notification I watch and then they're on.
Is your data secure?
My data is 100%. I mean, nothing's 100% secure.
No, but you know.
Yeah, but no, it is, and that's why I'm spending all this time. And that's with the money is how do we make it so these universities can have it on-premise computing and also the data storage because they have a closed LLM on their campus, like and they want to run it through that.
Yep.
I don't want to worry about housing data or running computing when they already have it, right? So, yeah, good question.
So it pivots from software as a service to software licensing.
Exactly, yeah.
So get it.
Sorry, I missed some of your earlier content. I walked in a little late, but what kind of customers are the ones you have right now? Are those like research labs? You said universities.
Yeah.
But then your users, I mean, are those like, you said lab managers, graduate
Yeah,
students?
they're like boots on the ground scientists who are doing this stuff and like banging their heads saying, you know, it's taken me a long time to record this data, I gotta show my PI this data. So it's like undergrads, grad students, postdocs, PI, principal investigators. So everybody in that's actually doing their research.
So is it actually another flavor of an ELN, like the electronic notebook?
So we provide like the feature of like automated notebook for them. So, and you can decorate that, add your notes too. So I mean, it is kind of it is a flavor of an ELN. What I'm trying to do is just capture that data for them perfectly. So whatever they want to do with it, whether it's write a notebook entry, which we do out of the box, or people like one of the customers took that to writing SOPs. Like, what's a better SOP to write than based off of what the professor did? I mean, you probably don't want to follow exactly what they did because they probably don't know what they're doing all the time. But you know what I mean? So it's like this ultimate source of truth that we're capturing. And even like capture really quickly, like some scientists are like, oh, can I turn it off and turn it on? You know, and it's like, well, our principle is just to capture everything, and then you can do whatever you want with it. So.
There's another company called IBDS, the Denver company.
Yeah, I know
that's
that.
coming out with like some, like that list of your competitive landscape, how it could be run over.
It could be really long, and it also depending on. I actually talked with a lot of companies to figure out what their direction is. The reason why I take off companies like that is their direction is going towards industry. We are very much towards academia, and that cuts off a lot of, because even like them or like Foreign Bio, you see like, oh, for academics, I talk to them, they don't actually want to sell to academics. It's not the biggest slice of pie. They want to link up with a pharmaceutical company, serve that customer, make their money, and leave. I want to serve, you know, it's riskier, but I want to serve the millions of scientists that are doing academic research, and I don't, yeah, so that's why I cut off some people.
All right, we're in the K's now. Kent, and then Kristen, and then Kurt.
So over here, hey, just to clarify, your business model is going to change from selling to individuals to university IT departments because it's going to become a license that's on-prem. I wasn't following exactly how that's going to transition. And then will that change the 90 cents per user?
Yeah, they're actually making it go down if they start using their own data storage and stuff. So what I've been
So I'm sorry, so that 90 cents includes data storage on your system?
Yeah, because there's actually really not that much data, and considering how cheap we can store it. So that's like the price of running an LM, the API calls that you do per month for the average user, the data storage, and then like the hosting for us. It's about 90 cents. So yeah, right now individual users come and do it as software as a service, or I want to talk to these research computing departments and IT and say, hey, put it on your campus and you just license it for the whole university. I'll give you, we'll figure out how that looks. But so I'm talking with Michigan State about what does it look like.
Okay, so then you make no claims on owning the data or owning the inferences or ever having any claim on it?
Yeah, so I might turn some people off, but I have no interest in owning and learning from that data because of who we're serving. I have interest in empowering them to have their data in that format. So yeah, we're very university friendly right now. I might change, but right now that's just where I'm coming from.
You change there's a lot of universities.
Well, I mean, and the first question is security, and then are you like, what are you doing with this data? And I say, I don't know, I gotta give them an answer.
Yeah, that's the right answer. Kristen, and then Kurt.
Yeah, I was gonna ask about the point of sale, who are you selling to in the university? So I think we got comfortable with that. So I'll flip to an add-on to a prior question, which is product extension. We talked a little bit about this earlier, but could you talk about voice or other additive? Because if a lot of the 915 is going to R&D, then and not biz dev, we're trying to shorten the sales cycle, et cetera. Then what is next? What else?
Yeah, so right now we've got two integrations that are more of like data science, people that you do on your personal computer. So what we're aiming for and what we're showing is that how do you have one central activity feed of all of your work syncing to one spot. We've also been doing some pretty cool research. We stalled out on it for now because of just bandwidth, but with using cameras. And so how can you take this camera on people doing work. So our whole philosophy is how can we capture this work with perfect recall and provide a platform for these scientists to at least have that, and they can do whatever they want with it. And we're just in the background, not changing the way they work, not telling them what to do, just saying, hey, here's everything we've done, do with it what you will. So we're working with like voice. We haven't worked with voice yet, but we're working with video and voice. And yeah, there's a lot of potential.
There's a couple nodes in the Point Angels portfolio that you could partner with that have a lot of what you just described off the shelf plug and show.
Yeah. There's a lot in like the medical field with like dictation and
No,
video.
but when you partner with an investor's portco,
Okay.
it leads to more good things with that investor.
Okay.
Kurt.
Thanks. So I've got two questions. The first one on the market, the
Yeah.
target market. What's the difference? A lot of research happens outside of the university context. So help me understand what is it about the university environment that makes it, or what is it about like the corporate research environment or something that either makes that a good market for you or it makes it not a good market for you to take a different approach?
Yeah, that's a really good question. So in academia, like, because it's a centralized department that's running the supercomputers, people are kind of converging and all going onto the same system, and it makes it extremely easy for us to, integrate with what we're doing. There's also like national labs that have like supercomputing centers. There's like these open initiatives where like anybody can get access. There's AWS. But yeah, so right now we're focusing on kind of the easiest market to penetrate because of how just convergent everyone's work is in academia. But there's no reason why like Eli Lilly, for example, their supercomputer, like this can also be integrated with them, right? But there's more nuances between that and between all of the different universities. There's kind of a cloud of universities in the infrastructure here, a little bit more scattered when you actually look at the nuts and bolts of these other companies. So
So it sounds like it's less of a infrastructure limitation and more of a kind of organic expansion.
yeah, and we've really, yeah, exactly.
And then the second question on alternative technology and competing approaches.
Yeah.
Some of the big companies like Microsoft and others, they're launching things like Copilot, a company, and tools like Pointe and these other types of things that for an enterprise license, a big organization can start to get notes in some of these things and can ask for different types of information from data sets.
Mhm.
So what is it about those tools that either is going to be competitive with you or is just, I'm a layperson in this area, so it's maybe just not even in the realm of possibility to deploy a tool like that against this challenge?
No, that's a really good question. So basically, like, we are just the interface of capturing all of that data into the spot. So somebody else talked to me about this, an AI scientist who's way smarter than me. And he was talking about how you can use the data we're collecting to then contextualize Claude and these other tools like Copilot to now make our product even better. So we're just trying to be that capture point, and you have the flexibility to use all these other tools. Like how do you, I see it like this. I'm a scientist. I'm walking down the road. Every new piece of knowledge I'm like picking up and throwing in my bag, and I should have access to every single thing that I've done. And I'm going to give them access, and whatever they do with that bag, they can put it into Claude or put it into AI Copilot. Like they can do that. We're just the bag. I've never said that analogy, so I don't know if it makes sense, but that's how I think about it.
Actually, here. Hold on to that until you're done, because you may need one of your back matter slides to answer this next one. So, love it, hate it, Jupyter Notebook is everywhere.
Yeah.
And you did not list them as competitor, but you did list them as an integrator.
Yeah.
For the site license that a University of Michigan, Michigan State University, or Wayne State University already has with Jupyter, can you use them as a channel once you've integrated with them? So they're basically selling a Jupyter Plus that sub-licenses back to you, or do you have to own the customer?
Yeah, it's an interesting point. So we have our development version of the Jupyter integration.
Mhm.
So because people are already using it, so we're trying to meet customers where they're coming. Yeah, I'm actually, I'm not too sure offhand.
But you're looking at them as, they're out there, we're gonna talk to them.
Yeah.
And I'm thinking about them very much, I think, where Kristen was going with her question of, how do you use that to get more customers?
Yeah, because I think we never leverage each other. We think, hey, you know, people are using you. Now here's this extra impetus with us, you know, syncing all of your work to this shared feed.
Mhm. Well, we already rolled our eyes and rolled up our sleeves and we're using them.
Yeah,
Yeah.
yeah. There's a lot of people using Jupyter Notebook.
Yeah. All right. Last questions for Dane. Thank you very much. Please advance your slide.
Sorry.
There you go.
Take it out of it.
And speaking of bags, that was a perfect segue, Dane. We were privileged to meet Revel Next at a biosocial event. We have a scout deeply embedded in biosocial.
Happened to be, yeah.
And Brian, you're in the process of moving to Michigan.
Hopefully.
Well, let's put a little afterburners on the hopefully part. Brian Jordan, you have 15 minutes to tell us about the bags.
Thank you very much. Really
Down
appreciate-
button.
Down button. Thank you very much for the opportunity to speak to everybody. Brian Jordan, CEO of Revel Next. And today I'm going to talk about poop. Now we all know that everyone poops, but ostomy patients, they poop differently. They poop through their stomach. And what's an ostomy? Well, it is a life-saving surgery. And usually it happens due to cancer or some other complication where your intestine has to be removed, and now you have this opening called stoma where stool has to come out. That stoma allows that stool to come out and will be able to be captured in a disposable pouch. And this is a challenge because of the fact that now you have to relearn your bathroom habits. And you can imagine how much of a struggle this can be for people. It's usually an emergency situation, and all of a sudden I wake up and I have an ostomy. So the struggle is real. And Sarah Levitt, who just is an influencer, just came out with her story in People magazine. And when she was growing up, she had multiple surgeries. It was very challenging to have friends. She was always in fear, a state of fear. Why? Because those pouches can leak. It can have pancaking where the stool builds up on the stoma and basically pushes the pouch off of you, and then you have a messy situation. Odor control. No one wants to smell like poop all the time, right? And there's that fear factor of, do I smell like poop? And so this translates to body image and confidence issues. And you start trying to navigate this with, what can I eat? I don't really want to have to go poop, right? So what should I be able to eat? So you don't even enjoy your food. But Sarah and others have a story of resilience. And the way they get there is the fact that they can embrace it through finding out what works. And one of the things that works is our Revel products, which I'll get to in a moment. But Sarah is now a delegate of Miss Canada. She is a model and influencer, and she works with us, which is great, promoting our Revel product. And she is not afraid to show off her live, which she calls her stoma, right? And living out loud, right? Embracing the fact that I can get to from being a patient to being a person again. And how do you do that? Well, Revel, we find ways to create innovative products, this deodorizing lubricant, to empower these ostomy patients to become people again and have a better quality of life. Our first product it's in the bag, deodorizing lubricants. And this is based upon MIT's Liquid Glide technology, which was a time invention of the year. It's an oil-based lubricant, and this is new. Every other lubricant out there is water-based. And we also have that technology that allows the stool to flow from the stoma down into captured at the bottom of the bag. No more pancake. It's fully regulatory approved. We're out in the US already selling. And the package design, I brought some samples over there to pass around. The package design is unique as well because it's about all one-handed dispensing and convenience. It's a lifestyle brand, again, to embrace that journey. We want to embrace that feel of being able to become a person again. And we customized scents because of the fact that we wanted to offer choice. We wanted people to feel like I can actually feel like I want to use the unscented lavender or eucalyptus. Everyone else, all the competitors, just give you one product and that's it, right? How does it work? Well, The technology is such that think of gel-like structure as you apply it into your bag here at the bottom. You can rub it up to the top of the stoma, and it holds the liquid, the oil lubricant there, for up to 24 hours, maybe even more depending on your outfit schedule. What that enables is the stool can slide right down. You have a cleaner, empty, easy to use, faster. You can get through bag changes even faster now as well. Our competitors, because it's water-based, actually their products mix with the stool. Our oil doesn't mix with the stool because the stool is about 70% water. So oil and water don't mix. That stool just slides on the lubricant and stays there up at the top of that stoma going forward. Head to head, we beat the competition. It's really amazing. We alleviate pancaking, a cleaner experience. We do reduce odors, and that's really the focus of the other competitors. But all the things that they don't do is they don't actually solve the problem, which is pancaking, leaking, and getting stool down to where it needs to be empty. We also have the ability to have a cosmetic appeal. So this package here, right, is purposely more cosmetic to feel like you can put it on your counter. It doesn't feel like a medical device. You can see all of the other white label type packaging out there. It also can be turned over. It's one-handed, so that as you're holding onto your bag, you can turn it over. It doesn't drip. A lot of these other actually drip. The other feature is that this comes off. So basically, the other, but the other different competitors, what they do is they have the tops will fall off in the toilet. So we've created a flip top cap so that wouldn't happen. So this is all inspired by ostomy patients, their comments, their feedback, in order to get an easier time and actually have a formula that works. We have currently on the market our 8-ounce bottles and our travel packs, and we have great reviews. It's almost 5 out of 5 stars, and the feedback is in tears of joy. This has changed my life. I can trust that my product is working. The stool goes where it needs to in the toilet, and I feel better, and I go out of the bathroom not smelling like anything. Right now, we have D2C through our revelostomy.com website, selling at $18.99 a bottle for 8 ounces and $8.99 for our travel packs, which I'll get to in a minute. But really, the story of Revel Next is a story about resilience as well. I was originally working on this brand in a previous company, and I was the technical lead. My background is actually chemistry, formulations, and packaging. And so what I saw as my company was going in a different direction was that I was working with these patients, and the patients just said this was a game changer. I got to get the feedback right away from them, and I couldn't let that happen where basically this couldn't be on the market. So I gathered a couple of employees, and we said, let's buy the assets, let's take this as an opportunity and move this forward, okay? And so direct to consumer, as of June 1st, when we bought all the assets, we already have 20K from our website. That continues to go up even as we speak. It's really amazing to see. I love to see the click on the button and helping people as well as they're ordering product. Distributors are really important because that's where this is fully reimbursed. So we have a HCPCS code that allows reimbursement for Medicare, Medicaid, and private insurance. We have Byram signed up, which is about 30% of the market in the U.S. right now. Sound Health is out on the West Coast. They just signed up just recently as well. 160K worth of sales so far, gross sales that we have. Additionally, distributors that we're talking to, Edge Park is about another 30%. They're partnered with Cardinal Health as a drop ship opportunity there. So there's 1-800-MEDICAL and other ones that we can get through Cardinal Health. And then we just signed up Premier Ostomy, which is expanding into Canada as well. So what is the potential? Well, we are delivering solutions to be able to improve quality of life, and we're starting out with the deodorizing lubricant. We're looking to get at least 10% of market share, and that might be even able to go higher given the feedback that we're getting right now and how competitive our product is on market. There's about 62% of patients that are currently using lubricants out of the total out of the total amount of ostomy patients using lubricants right now. And so what that is that there's ileostomy and colostomy. Colostomy tends to have need a lubricant, whereas ileostomy has thinner stool and may just need the deodorizing effect of the lubricant. What we've seen is two things. We're starting to impact the ileostomy market as well because of the fact that our lubricants are very good at masking the smell for deodorizing effects and also for a cleaner package. And so that allows easier emptying, faster emptying. They're not messing around with all the toilet paper and everything else. There's about 1 million patients in the U.S., about 50,000 patients in EU, but the fact is that these are really growing because of all the surgeries out there in those two regions, and with all the colon cancer on the rise, it's actually starting to really ramp up, which is scary in its own right, but for us, we're adding a solution to help with all the problems and being a lifestyle brand to help them as well. The key to all this is once we can get in there, this is really a market entry for us, learning feedback loop. And there's a lot of ostomy products on the market. And the competitors are just selling pouches. That's where the big money is, it's just selling pouches. But their volume is just trying to sell as many pouches as they can. They're not solving problems. And so with us getting basically free support, through the support groups and talking to patients, we're able to get this great marketing information. And with my product development skills, I've been able to get 2 or 3 products on the market already in my lifetime, in my career. I have a confidence that I can get through innovation, come up with a custom pouch that allows this ease of use, along with our lubricant, to get that stool out and make it bag changes easier going forward. So what we're going to do here is we have variable pricing. We have a little bit more volume pricing from the $18.99 on the bottles. They're fully reimbursable, but where we can target this is through distributor expansion, both through the number of distributors that we have. We're not going to be exclusive. We're trying to just build strategic partnerships that allow us to sell within those distributors in certain areas. Target U.S., Canada, and EU regions, where those are the biggest markets right now, and biggest opportunities. Maintaining our premium branding. We have, right now, we're selling online and we're driving traffic through our website, and that allows us to maintain that premium branding rather than being a commodity on Amazon. It also allows us to have education. Education is very challenging. At the end of the day, we basically wake up with an ostomy and kind of get kicked out of the hospital, and that's very unfortunate. And so we can partner with the UOA and other advocate groups and work with support groups to make sure on our website we're having education, connections to this education to be able to help those patients along their journey as well. We also are looking to expand the lubricant usage, new patients and tackling new patients and going forward with that. And also we have some new line extensions with the scents because of the fact that we've heard that, most of the feedback is, well, what about some neutral scents? What about some masculine scents? What about some different scents that work for me, more customizable? And so because this is oil-based lubricant, we have ideas of how to do that for them. So you don't have conflicting smells of some cologne with a lavender scent in your bag. So how do we do this? How do we go to market? It's really all about getting to the end customer, which is our patient, but you can go through a bunch of different ways. You can basically go through distributors, through reimbursement, but also they need a unique offering. They need to be able to go out and say, come get your supplies at us, we're better than this other supplier. The suppliers are just, they don't know other suppliers, right? They don't really have any unique technology. We have the unique technology. We're sponsored by Sarah, getting Premier Ostomy just recently in Canada on board. That's how the connection can work and go through. TikTok, there's all these different TikTok influencers out there that have connections with these distributors already, and we can leverage them as well. Doctors and nurses, it's all about the data. It's all about trying to show the data in refined terms, using my PhD in chemistry to show how this data actually translate in real patients. And so we're working with 2 nurses currently in the WOCN to gather that data with patient, I won't say trials, but they're basic post-consumer surveys, and being able to show that our data that we saw in the lab and we're hearing from all these reviews are getting where we need to go. And lastly, is nursing homes. It's just basically, there's a operational cost for nurses to change out bags, takes 30 minutes, and per patient. If with our product you can get to 5 minutes just dumping and emptying, and that allows nurses in the nursing home, because they're already stretched things out as well, to be able to basically get the product or basically handle all the patients that they can. Finally, it's direct to patient. So we're attending support groups. These are virtual events. We have we're sponsoring Run for Resilience World Ostomy Day on the 4th of October. We drive traffic through our website. We have sampling and loyalty programs, so we have samples already available, free samples, lavender, eucalyptus, and unscented, so that we can go to these support groups, get feedback right away. We're already on our way on these milestones, but again, it's really about geographic location, getting more distributors strategically placed there, being able to get into the EU and ramping up the revenue and the operations to keep up with product demand. And this all will allow us to basically get back to reinvest in the next solution to handle that 90% of that market, which is this custom pouching system, which is currently in this concept development process. So as you can see from the financials, we already have 163K. We're on target to hit that 370K mark for this year. About 50 or so K per month is our revenue incoming. We will focus in on the lubricant sales specifically, again, geographic location, distributor expansion, and then being able to reinvest in that custom pouch development along the way. The cost of goods, we're about 50% or so margin, and being able to expand that for economies of scale. And then our operating costs and sales marketing costs are actually fairly small because we already have the equipment and the facility there, but we're presently in Massachusetts but looking to scale. This is the team. I'll skip that, but we can go back. We all have different attributes, but really the ask is around 150K through a common stock purchase. And the use of funds will be scaling, being able to start an ambassador influencer program here with all the hospitals, Detroit or Beaumont and Henry Ford, and being able to execute some capital for the selected lines. Thank you for your attention. I'll take any questions.
Catch my eye if you have a question. I'm going to ask you the first one, which is, you made $160,000 this year just from distributors, and you're talking to Cardinal. Why do you need our money?
Great question. So right now, to close the gap, we need to be able to just scale. So when we first made this, we have a 10 bottle per minute.
That's the line in Massachusetts.
That's the line in Massachusetts, and we need to be able to scale this and be able to get to 100 bottles per minute.
If we showed you a co-packer in Michigan that could do that, would that get you here soon?
Yes, that could be helpful. Yes.
Who else has questions for Brian? Luke? Kurt?
Focus on this one. So the IP that you licensed just a couple months ago, earning great revenue behind it, that's great. Is it exclusively for oxygen, or is the lubrication and scenting available for any other lubrications?
So it is exclusive for Osmir in those geographic locations.
Sorry, geographic locations?
So it is
US,
in
Canada?
yeah. So U.S., Canada, European Union. We do have Japan and a few other Asian countries.
What about trademark protection?
We had through the asset purchase, we have trademarked already for Revel, and we also have
Same trip as the patents?
yes.
Kurt?
Yeah, thanks. Seems like a product that would have made people's lives positive way. I'd like to understand the market opportunity a little better. Maybe go back to your slide. Oh, that was the EDO. Okay, so so many patients in the US, let's just stick with the US market, it's around $20 per bottle, 19 bottles.
Yeah.
How many bottles does a patient use per year?
Great question. 12. So they get reversible up to 1 bottle or 8 ounces per month.
For an unreversed ostomy?
Yes.
So if it's reversed, obviously.
Yes. So there's a permanent ostomy, and those are more on the rise, but there's also ones that you can reverse and temporary. Either way, those values, basically there's about 70 or so percent of those are permanent ostomy. And that out of that 1 million, about 30% get reversed. However, there's more growing as basically for about 100.
That's what I was trying to understand. Assuming that each one of those patients become a customer, is like $230 per customer per year,
Yeah. Yep.
I was trying to get to where, I just have no concept of the market size.
Yeah.
So I was trying to understand what
bootstrapping with the deodorizing lubricant product and being able to reinvest into our custom pouch. And so if we exit with that before the custom pouch comes on marketplace, that would be probably 2 to 3x revenue, somewhere around 80 million or so for Hollister, Allspace, or the big competitors that are out there, because their products don't work and everything like that. There's a choice at that point that if we wanted to, we could either keep going or just have to have that deodorizing lubricant part and be able to then go to the next step, which is the custom pouch system, which would allow us to get to that larger target for maybe another exit or an additional exit here to attack that global supply, or global supply market, which is pouches, which makes up about 90% of that.
Okay?
Yeah, the $150K for a common stock purchase, do you have an established share price or enterprise value?
Yeah, so it's 60 cents right now per share.
And that equates to what if it had been enterprise value?
So it's 5% equity or so.
Following on Kurt's question about the exit, who buys a company like Revel? I know you need to find this out last time because of the transition, but were they headed for an exit? Was it to a distributor like Cardinal? Was it to a ostomy product? And where does this lead?
Yeah,
Who needs this?
good question. So, I think Hollister and Compotech and Coloplast, they do look for these type of companies for merger and acquisition. So their R&D is lacking because of the fact that they're just producing bags and they
These are bag manufacturers.
these are primarily bag manufacturers and they do other types. So they're not just in ostomy, they're in other type of medical devices. But then this kind of medium tier opportunity is there's a New Hope and other type of companies out there that sell ostomy supplies.
These are specialized verticals that we don't know.
Yep.
So I'm zeroing in on Cardinal.
Thank you.
Um,
So Cardinal is more on the supplier side of things, so what they do is they're just kind of the Amazon medical supplies.
Yeah.
But the other medium tier ostomy supply companies, which will compete with Hollister, Compotech, and Coloplast, have the opportunity to, we have an opportunity to sell to them, to be able to merge with, their existing supplies for deodorizing.
Do you have comps? Who have they acquired lately?
Good question. So, I don't right off hand, so let me
You're not supposed
take
to
that
have
road.
all the answers.
Let me get back to you. Yes.
All right, Luke, and then Alex.
So congratulations on the revenue so far. My question is, how much of that revenue is $42,000 you spent on marketing this year? So I just looking at the pro forma there, how much is influencer based, and how sustainable is only doubling your sales and marketing expenses over the next 5 years?
Yeah, great questions. Right now, the influencer is very small percentage of that. It's only maybe 5K, if that. Sarah Levitt, who I just talked about, she did everything for free. She basically introduced us because she loves the product so much, and because this is what's happening with the feedback that we get. We're actually not having to pay influencers, investors that much money to get this word of mouth. It's shocking, honestly.
Shocking.
Yeah, so because
It's organic.
because the quality of life changes and they live it. And the key to all of this is a word of mouth type of industry of it, because there's support groups that are virtual, right, with COVID and everything. So I don't have to travel everywhere, and my team doesn't have to travel everywhere just to show up in a support group. We just log on online, send the free samples ahead of time, and then be able to say, what's your feedback, how do you like the product, and we get instant feedback there.
Dude, that's your go-to-market? That's terrific.
Yeah.
Sorry, just to follow on that, is the revenue listed here your net of the distributor, what the distributors pay you, or
So
are the distributors are taking that fee, they're cut of the
Yeah, so, the revenue listed here is D2C sales plus revenue, from the distributors. So the way that it works for the distributors is that we sell in at a certain price, and then because of the reimbursement, they can only go to a higher ceiling, so they get margin off of that. So we don't sell at $18.99 to them, we sell a little bit lower at $16.50, because it's volume pricing for them.
What's the reimbursement?
What's the reimbursement?
Yeah.
It's around $22.
Got it.
But they also, because they have, it's about 2 million or 4 million enact that process of being able to do reimbursement, so that they already have those processes in place to just activate that.
Oh, no, it's, yeah.
So we let the distributors do that part.
Cool. Alex, and then Vika, and then Bobby.
Couple quick questions. So, pancaking is obviously a big problem. I mean, had one before. So how do you measure the metrics of your product versus the Hollister product as far as pancaking goes?
Yes.
That's the one.
So, it was a great question. So, you may see videos of me online or somewhere where we created a in-lab testing device where we have a syringe, and this mimics a stoma, and we tested our products against their products, and we're able to see the stool come down, and then we created our own metric to say if it moves this much and how much of the amount of mass moved, and then that's how we could tell from lab tests.
There's no standardized measure.
There's
You
no
had to create
standardized,
that.
exactly. So, but what has been nice about this is we've been starting to translate that to real patient data as we're collecting it. And so we can get a paper out here very soon, WOCN, and be able to show our basically correlation between our lab test results with this apparatus and your patient results.
So what is your custom pouch system? Is that a lubricated bag then you're trying to create?
Yes.
Which is gonna probably triple the cost of the bag?
So there's 2 points to this. One would be so one of the things about stomas is, and you may know this, is that people's bodies are different. People's stomas are different. They're oval versus circular, right? So there's a flange, which is just an apparatus that can go onto that, but you have to cut it out, you have to kind of fit it, and it's really very difficult. People with arthritis, I can show you actually, right? So this is one of the bags, and you have to just basically cut all of this out in order to stick it on. And you have to get it right. If you don't get it right, it falls off, or you have leaks or other issues, right? It's one of the major issues there. So we can now drive stool to a certain location because of our lubricant. That is a huge effective advantage over anything else that is there. So now you can create customized opportunities where it fits to the person, right? Because we can our idea and the concept is to scan. I don't know if you guys have ever seen the Invisalign model. Are you familiar with the Invisalign model for scanning the teeth and then being able to have a 3D printed retainer, right?
Mm-hmm.
And so if we get that data from scanning that area, we can then go in and have a customized flange connected to a cartridge, which then can, with our lubricant, can drive stool to a certain location, and then that location can be emptied very quickly.
Don't they already have that though? 'Cause like when I ordered mine, I had mine preset to an exact 4 3/4 or whatever that had to take one. So that already exists.
So they have something called moldable versions of this, right? But they don't work for everybody. It's not one size fits all. So sometimes it's really great depending on what your stoma looks like. Other times, not so much.
The only other thing, and I can add to this, your nurses are going to be your best sell. A nurse will see 40 or 50 patients a week. So if the nurse tells you to buy it, you're going to buy it.
Let's hold the 4th and 5th questions forever. Vika, and then Bobby.
Can you tell us a little more about the team that is going to make this happen?
Mm-hmm. So even on CEO for the last 5 years or so, I've been on the manufacturing and operational front as well for this product, as well as another product that was made. And so I've learned, for everything from regulatory, quality, and manufacturing and scale up. And so I have a team that is working out in Massachusetts right now. That's why they couldn't be here, because we're making product as we speak. Dan is here. He's was a previous CEO of another company, but he had helped with the branding of Revel and the lifestyle of the branding there. He has a lot of marketing experience, so he's on board for doing that. Greg is our COO and supply chain and finance guru. He has a lot of experience with all these other companies. Have worked with Dan and myself previously, and then we have the MIT connection with Kripa, who with the MIT Liquid Glide Technology Time Invention of the Year. He was the co-founder of that originally.
So you three really split off of Parnassi to do this?
Yes.
Gotcha.
Yep.
Bobby?
I just wanted to ask a little bit more about the product. Sometimes when you have a deodorizing agent in it, it causes irritation and allergic reactions. Have you had allergic reactions or any problems with the lubricant? And the second thing is, why did you restrict it only to this very narrow, your patent only to ostomies? Why would you not patent the lubricant?
So I'll take the first question, and well, actually, let me take your second question first. Sorry.
You got 1 minute.
Yeah. The way that we want to do this, so in the asset sale, we actually purchased patent for the formulation, but it's specifically around ostomy. So that doesn't mean that we can't go outside of that, but we'd have to continue to, we'd have to build the IP ourselves. And so it has a chance for feeding tubes and things like that, maybe. And then, sorry, the first question
The
was.
deodorizing and allergic reactions.
Yeah, so we haven't seen any, we especially looked at what would be the least, with cytotoxicity studies and things, we have the least effect on any allergen, but there's no guarantee 100%. Everyone's skin is different.
Those are really good questions. Thanks, Bobby. And you're going to stick around when you go back to Boston?
Monday.
Monday. So he's here.
Yep.
Hit him up.
Available, yeah.
Appreciate you, man. All right, we are inviting back our happy portfolio companies, the ones that participated in April in Portfolio Day, and the ones that we haven't heard, thank you, from for a while, to fill us in on what they've been doing lately, what they've been doing with their money, and what they're going to be doing soon. And we have 2 portfolio updates today, one from Blacksands. Nathan Paul is here to describe what's going on at Blacksands. I have another one after that. Nathan, your 5 minutes begins now.
Thank you, David. Well, my name is Nathan Paul, I'm the CEO of Blacksands. It is great to be here again. I guess we're one of the first portfolio companies
That's
coming
right.
through. So, yeah, thank you. It's been a great ride. Some early investors here, Jim Agley is one of them, so thank you, Jim. And Craig Fowler, I don't see Craig here tonight, but yeah, so we're very, very grateful to them and grateful for you as well. So we're Blacksands is Blacksands Cyber, we're in the cybersecurity business, Zero Trust, and the world is hyper connected today. Everyone's connected. Your companies are connected everywhere, and it's under constant assault. And so what that means is that the castle walls have been breached, the moat's been recovered, the hordes are in your operations. That's the kind of typical cybersecurity, good news, right? Everyone's like, ah, right? The sky is falling. So that's classic cybersecurity. So what in the cybersecurity world today, the way they function is everyone is pushing what's called zero trust. I don't know if you've heard this term before, but basically the idea is, again, the castle's breached. Now go inside the castle, lock down everything, lock down every door, lock down every window, put a guard in every room, on every hallways, and nail down every chair to the floor, right? And so, the way that plays out in the cyber world is it's unbelievably expensive to do this. It is incredibly complex. It takes a long time. It's static. It doesn't scale, and so it's a business killer. And so this is a big problem that we're running into today is how do I deal with these important assets that I have in our company in a way that our business can still thrive. So our technology is a simple, secure, scalable, zero trust software solution. And there's 2 things that really kind of function to make us very, very unique and allow us to do this. One is we've created a cyber black hole. So we take your important assets. It could be a server, it could be an application, IoT device,
a PC you're doing, controlling, some factory equipment with, and we drop that in the black hole. So whenever some bad guy is trying to get at it, they start scanning it, start to talk to it, nothing comes back. Nothing gets out of the black hole. It looks like it's not even there. Then the other piece of our kind of secret sauce is that we've created a way for people to have individual connections. So we broker point-to-point encrypted connections from individuals into the black hole, into the one service you have access to. Not a VPN. If you're doing VPNs, that's the problem. That's what creates the Swiss cheese in your walls as it is. They're horrible. And so we're like that old-time telephone operators who go click, 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 click. It scales to N, and it's hyper visible. So what that means is as the company, I can have granular visibility and control of every connection while maintaining invisibility to the rest of the world. So we started off in the commercial sector. We did get traction into some global manufacturing, global energy, critical infrastructure, but we ran into what we call the brand problem. You've heard the old adage that no one ever got fired for hiring IBM, right? Well, this is even more the case in cybersecurity. So the way I was saying, Cisco could come to some company with a bag of wet noodles and they'd sell it and they'd buy it, right? But to get the new traction was always difficult. So a couple of years ago, the White House mandated zero trust cybersecurity for the entire federal government. We looked at the requirements and matched what we were doing, so we did a hard pivot. And in the process, we brought in a couple of key players, a bid and capture group of ex-military folks that help us identify customers in specifically the DoD, and specifically in the Air Force, which is controlling all the communications for the DoD. We've also brought on board Accenture Federal Services. They'll be on our next contracts as a subcontractor to us, and that allows us to, they bring credibility on our product. They also bring the ability to scale as we need to go global with these communication systems. And then when it's time to pivot back into the commercial, we have the ability to do that with Accenture LLP. We've had some success also recently. General Conley, who is the head of ASOC, Air Force Special Operations Command, has specifically identified our technology as critical for his global communications rollout. And I can talk to you afterwards a little bit more about what we're doing legislatively with that, and we've got some significant traction there as well. So our solution, we believe the U.S. federal is going to drive critical supply chain. We're already seeing this, and then go into regulated industries, and the rest of the markets will follow. And for us to get into the ground floor is critical here with the DoD, because they're going to drive the whole thing. We're currently in a kind of the final round of our SAFE. It's got a $10 million cap and a 20% discount, and we're raising $3 million so that we can basically have the time to accomplish this. Thank you.
This group invested in Nathan's company before I was ever a member, so this is actually the first time I've seen you present. So thank you very much. Next up, when we first invested, the name of your company, Andy, was Nanotherm.
Before, no, Smart Paint.
Smart Paint, thank you. I thought it was, yeah, right, Smart Paint and then Nanotherm. So what is it today?
Novara.
Just tell us more about Novara's new name and what they're doing. Andy,
Thanks, Dave, and thank you all for having me and for investing in us 23 months ago. We were Smart Paint. We've done a lot since then. 3 names since then. Back then, we were making nano paper. It was very much like the carbon paper you'd use to make copies. Very expensive, very difficult to work with. I was only talking to Airbus and NASA at the time. Then we learned how to make paint, which made it an order of magnitude cheaper. You could spray paint anything and put heat where you wanted it. That was another advancement. And we then turned into Nanotherm when we were learning how to make roll-to-roll products. And so what we're trying to do is replace nichrome wire and etched copper heaters wherever they exist today, and silver paste heaters. Those things have been used for 125 years. They haven't changed at all. And what we're offering to our automotive clients is a heater that's lighter, faster, and uses less power, and particularly interesting for them for EVs. We've shown that we can save energy in heating the passengers inside the cabin, creating microclimates inside the cabin, and then heating the batteries. So if you've seen those stories of people stranded in Chicago in their Teslas trying to charge, you know the trouble we're talking about. So the thing that drove the name change this time was our merger with Battelle. Battelle is one of the biggest national lab. They run all the other national labs, and they get a $14 billion piggy bank from the government every year to do that. And it turns out they had, in a parallel universe, they had been building a portfolio of 65 patents and 35 trade secrets for this nanotechnology, very much like what we were doing. We had a couple of choices. We could have been sued into oblivion, or we could have just joined forces with them. So we did that, and that was completed in July, and became Novara as a result. The good news is we have access to all of their scientists at cost, which saves us about half, and they value that at $15 million, so they're going to cap it at 15 for now. The other good news is they open up doors we couldn't even find. So there are people calling that we would not have been talking to even 6 months ago. And so the third part about the Battelle arrangement is we'll be a subcontractor for their military and medical markets. Applications in both those are going to be handled by them. We'll make material that we may or may not ever know where it goes. David, thank you for forcing me to be on one slide and not 34. I picked this one for a very particular reason. We live now in a building owned by a company called Entrotech. Entrotech makes films. They started by making the paint protective films that you put on the bonnet of a car for stone chips and things like that, right? He made about $1.5 billion doing that. But then he learned that you could put pigment and colors into those films. And so he started selling paint films, and they wrapped sports cars. And they realized we can save 80 pounds per vehicle if we just wrap the whole car in this film instead of painting it. That got the attention of a handful of automotive companies, and now you can buy a Land Rover Defender with the paint wrap on it instead of with a wrap on it instead of paint. And so I mentioned this to Jim, the owner of the company. I said, you know, if you can put pigment in there, colored pigment, you can put nanomaterials in those films. And so he agreed, and we had an initial run. And the first pilot run of that film was probably 10 times better than anything we had seen before. And we're just getting started with them. So this facility is a 50,000-foot clean room in Columbus, just outside of Columbus, about 20 minutes from our headquarters. They can run 72-inch wide films at 110 feet a minute. What this does is reduce our cost by another order of magnitude. So moving from nanopaper to paint was one thing. Moving from paint into roll scale manufacturing finally makes this a commercially viable solution for automotive in particular, where the second question we get is, how much does it cost? So that's a constant knife fight. We're finally able to answer the question. The third part of that is when we were asked by a flooring company that we can use this for flooring as well. We think our initial run would be 90 million square feet. Can you do that? The answer is absolutely, we cannot do that. Before, I had no idea how we were going to do that. I felt like that line in Jaws where he said, we're going to need a bigger boat. Last point, and I have to, because I don't have slides, I'm going to cheat just a bit. We just got back from Germany, and we learned there, that was kind of important, we learned there that, this is my prop I brought to show you. The coolant in today's EVs, this is a serpentine coolant for the battery, right? We simply put tape on the edge here, and you can see it. The tape heats up. Now we have direct contact battery heating, so those Teslas don't run out of juice in the wintertime. We save about half the time it takes to charge up, and we can incorporate other functions in this tape. So you can put flame retardant capabilities in there. You can make a stack up that does all kinds of things. So that's what's driving a lot of this interest right now.
I appreciate you bringing the prop. I will geek out on that after the program. I'm going to ask your indulgence. We're doing something a little bit innovative. I know that's not what we do here. I was privileged to see a presentation a week and a half ago from Mason Furlick, steeplechase Olympian, researcher, and founder of GripFusion, and invited him to join us tonight to basically get you as excited as I am about his innovation for the next 10 minutes. So, Mason, the down button is your friend.
David was kind enough to invite me out here. So I think we have 10 minutes. Questions, come find me afterwards. Sounds like I'd love to do a show and tell and demo. So I'm going to talk today about GripFusion. GripFusion is an AI-powered sports technology company, and we're pioneering grip sensing sporting equipment to transform how athletes train, perform, and prevent injury. So I had to throw a slide in here. Any Michigan alum here, go blue. So I'm going to do my background in 60 seconds. So I ran track and cross country at the University of Michigan. Cinderella story, I was dead last at the NCAA championships my freshman year. Finished my senior year as national champion for Michigan. I studied aerospace engineering. Go blue. Yeah. Wanted to be a rocket scientist. Realized my legs were great for running, not for fitting under the Space Shuttle Console. I had the privilege after that career at Michigan to sign a couple professional running contracts, and the highlight of my professional running career is I ran at the Tokyo Olympics for Team USA on the 3,000 meter steeplechase. I got to travel the world racing against world-class international athletes, learning about different training and sports. Simultaneously, when competing on the international stage wasn't enough, I was leading a research lab at the University of Michigan in sports science. We were cutting-edge biomechanicals, athlete gait assessments, and from that, we are dealing with the fire hose of data. And we are leveraging the advances in miniaturized and wearable technology, but I was seeing the gap in translating that information to the athlete for the decision making. So I'm now back at the University of Michigan, triple Wolverine, finishing a PhD in statistics, where my research focuses on algorithmic decision making, exactly like we do as athletes every day. Wake up, decide how to train, and use the best information possible to make the best decision possible to maximize performance on the world stage. So I like to think of, this is supposed to be a slide animation, what I'm doing at GripFusion is the synthesis of all three things. It's elite athletics, it's advanced engineering, and it's AI-powered technology. So we're starting in baseball, and I know we'd all like to be at the Tigers game right now on this beautiful fall evening. Analytics have transformed the sport, okay? Teams rely on these advanced decision-making metrics to scout, recruit, player performance, fan engagement, you name it. Analytics is baked into the fabric and the ethos of the game. And teams are now spending $1 to $2 million on the low end annually on just the tools and the hardware to give them a performance edge, not to mention the whole team of scientists, biomechanics, and data scientists down every single staff to make sense of this. Or if any of you guys follow the sport, there's kind of an elephant in the room, and that's the throwing injury crisis, right? And it's continued to skyrocket even though there's an investment in performance technology that hasn't paid off. So we see performance, but we don't see any improvement on the injury front. And it's now over 50% of Major League players are having to sit on injury reserve lists, and this equates over to $500 million a year lost salary cap. And this has trickled now down to the youth sport. So throwing injuries in youth baseball are number 3 behind concussions, ACL tears, and now elbow injuries. And over 30% of youth players are having to take off significant time due to throwing injuries. 18-month recovery if they do get surgery. It's not a question of if, it's when you get hurt. And there hasn't been principal technologies that can solve this crisis. In fact, so much so that the MLB put out a directive to the next decade on how to solve injury and player longevity. And so we're coming at the right time. And we believe that the problem with today's pitching technology, so focusing on baseball and baseball pitchers specifically, is that the existing systems only focus on ball outputs. Okay, that's everything that happens after the ball leaves the player's hand, spin rate, velocity, movement, break, you name it. However, the most crucial factor, the grip, remains completely unmeasured. So I like to call these grip mechanics, which are like finger placement, pressure, release, timing. They are the inputs that drive ball command and performance. And right now, they're only coached and analyzed subjectively. There's no system or technology on the market that can capture these critical inputs. Therefore, players and coaches really only have half the equation. We have really advanced output, Doppler radar systems for measuring what the ball did, not how the player interacted and held the ball. And so there's less guessing what works, there's no real-time feedback loop, and critically, this workload and arm stress goes unmeasured. Okay? And so what we're doing at GripFusion, and this is the driving kind of mantra behind our company, is to connect the inputs to these outputs, right? And this is to give players and athletes a complete picture of their performance spectrum. And so in baseball and pitching, it starts with the grip profile, this pressure, release timing, all the important factors in pitch design that influence the spin and velocity and performance outcomes. So we are looking at the top of the chain, the other side of the coin, which is these inputs and how we can use these to drive player performance, health, and skill development. And so we're doing that by building what I call the world's smartest baseball. So this is the world's first grip sensing baseball that captures grip mechanics of every single throw. It allows for instant technique feedback to the athlete and the coach, right? And I like to call this the plug-and-play system. It's a baseball. There's no setup. There's no calibration. It's zero compromise. Athlete can pick it up, tap it to weight, connect to the iPad, and start throwing and getting that incredibly valuable grip mechanic feedback. And so critically, we designed it to have the look, feel, and weight of a standard MLB baseball. Okay. And at its core is the GripFusion patent sensor technology. So this is 688 pressure sensors embedded beneath the leather of the baseball. Okay. You mentioned roll-to-roll manufacturing. We're leveraging existing manufacturing processes for thin film electronics to produce these sensors, but came up with a patented completely novel sensor architecture that allowed us to take techniques for typical rectangular flat touchscreen displays and wrap, in this case, a sphere or any organic object, right? And so simultaneously, there's also embedded electronics. We've miniaturized our signal processing, streams the data over Bluetooth for a single stop performance engine. So we've been very successful in our hardware development, MVPs. Actually have version 3 of the Force Ball coming out this fall. We're working hard on the software side. So I like to think of GripFusion as our hardware is trying to be ubiquitous, undetectable to the athlete, and really we're delivering value through our analytics platform. So we're working on our AI-powered training program to translate this brand new spatial temporal grip data into real-time insights for the athletes. So really excited about that. Really excited about where that goes. Right now, we have an alpha release plan for fall 25. Like I said, we have version 3 coming off the product production line. Testing with MLB strategic partners. So my co-founder, which I'll talk about, the former pitcher, now chief of shoulder-elbow surgery at Stanford, head team physician for the A's organization, very well connected to MLB, sits on MLB Science Commission. So MLB, at the top of the sport, is extremely interested in this technology and what we're doing because it fits their directive in how to help improve athlete safety. And simultaneously on the performance side, these teams are really excited about how this can give them the all-important competitive edge. Right? And so we're really excited about spring of 2026. We consider our beta release to kind of an exclusive cohort of high-performance teams that are really going to help to drive this co-development process. We've already had great conversations with all the teams on here about how we get this technology integrated into their workflow, their bullpen. Their data scientists, their sports biomechanists are our biggest champions within this organization. They're really tied in how we spin up leverage their expertise into continuing to drive the analytics engine we're building. Also establishing, so this is on the sports performance side, but establishing really good relationships with manufacturers here in Michigan, Detroit. And while we're starting in baseball, there's immediate need all the way from the top of the sport, 30 pro teams, elite, minor league teams, all down the spectrum, into the college market. And the big one, though, is the youth and amateur market. We really want this to become the one-stop shop, like pitching performance tool that Johnny and his dad can go into the backyard and learn to throw a curveball correctly. Can learn to grow with their hand size, grow with their maturity as they go through puberty and get to U12, U18. Really a device that teaches players proper technique, skill development, and performance. And so, we see a big market that this will become a consumer product that every single player will have to have. And if any of you have children, you know the dire cost of youth sports these days and the unending arms race just to be at the top. But we don't see this technology limited to baseball. Why we're starting that, so beachhead, we really think this extends to the golf course and golf grips, baseball bats, tennis rackets, softball, and more. embedding grip sensing modalities into sporting equipment, because this is how we as athletes and humans interact with the everyday world, and it can teach us a lot. And so, baseball is just a small slice of that larger sports technology pie that we really want to roadmap out over the next coming years. So on the baseball front though, this is going to be a software, hardware subscription model. So thinking of it as leasing the hardware to these teams. We're a grip assessment system, so all 200 pitchers in the Tigers organization, from pros all the way down to the minors, they can have a one-stop ecosystem to analyze their performance and injury risk, and expanding that to the collegiate market, and then shifting to a B2C, direct-to-consumer market for the little leaguers and youth. And so yeah, my last slide here is we've had incredible buy-in from the University of Michigan, where this core IP was licensed out, co-inventor. So we have all 3 Michigan funds, ABF, MUICF. I'd love to have you join this opportunity.
That is why Mason is here. I want to point out, where is it?
You can pass these around.
This has never happened before. This is called the Michigan 3-fer. Mints, Accelerate Blue, and the Michigan
MUICF.
Yeah, I can't pronounce
Michigan University Innovation
3
Capital
funds,
Funds.
3 different fund managers, and they're all in on it.
They all did their separate due diligence. They
Which
all
we
had
have.
multiple rounds of interviews, product demos, hardware team, software team. Really excited about where we're going. Invest Detroit's in. I think there's a really big excitement and opportunity here to kind of transform the language around
Thank
sports
you, David.
technology. Thank you, David. Come talk to me after. I'll be downloading after.
And I will be wrestling you on the podium. It's time to play. Jimmy sent me the nicest sad email right before we got here, saying he's busy stage managing the State of the City address in Macomb, Michigan, and couldn't be here tonight. So Jimmy, you're watching this on the stream. Congratulations, you won the Spirit of Pointe Angels Award for August. And the way you did that was by using that barcode that's on your table, pointing your phone at it, and playing Carp Tank. Carp Tank is our simulated investment game. The 6 companies that we just saw present are all in Carp Tank. And what I want you to do is take $1 million and spread it around. Put it all on one. Put it all on none if you think they all stink. But this is compared to our model investor. We have a model investor to determine who is the Spirit of Pointe Angels Award winner for September. But I'm going to tell you the dirty little secret here. It's also how we see which companies you're interested in, and we can do our pre-diligence, diligence, and deal making. So if there's a company here that caught your fancy, put some of your monopoly money on it. I'm going to play Carp Tank for the next couple of minutes, and then I'm going to invite Kristen and Kent to join me on the podium for our deal bottle ceremony. What does it say?
The previous one is September 2024.
No way. I believe you. Well, this says August, so I'm just way out of it. All right, everybody's got your barcodes working. While you do that, I'm going to talk about deals in motion. We have put out investor calls on eCore, Maxorbio, and Revimo. That's because they completed our diligence, and we have completed venture files on all 3 of these ventures. This is the last call, my peeps. If you want in any of these deals, you better raise your hand really soon, because the train's leaving the station, and you're just going to have FOMO on Monday. Or you can go out a couple of weeks, because the deals that are heading for investor call are Braze, GripFusion, and Light-Handed. And you might wonder, well, you just saw GripFusion. How dare they jump ahead? In fact, that wasn't my call, that was Raphael, that was Don, that was Dave Rabb. They put him in the slot. So all three of those rounds are on track to overfill this month. If you want a piece of them, this is your moment.
If I go back, what was the investor calls out? What's that mean?
That means we've completed diligence, and to the folks that raised their hands on those three deals, we send them the venture file and said, you're in or you're out. Are you in or you're out? You want one of these?
Yeah.
Well, we're nearby Ecor in a minute. Exorbio is a venture that presented in June. In May. Exorbio makes a patented alloy for orthopedic surgeons. It is as strong as the plastic plates and screws that are often used in orthopedic surgery. They're as strong as the titanium and as dissolvable as plate. And Revimo, you saw Revimo. That's the patient hoist mobility device. Spatulas your butt up out of the seat and yeah. Right. How will we get new venture files on these now? So we welcome to the Point Angels portfolio Ecor out of Cambridge, Massachusetts. Ecor makes an uninterruptible power supply for manufacturing plants. So this is a big ass battery. And the way it saves the plant manager money is by shaving off all the peaks when engines get turned on and turned off. They've shown a critical sub 3 year, in some cases sub 2 year payback that makes plant managers drool. And grid operators really need this because there's just not enough capacity otherwise. This is a good solution for both sides of the equation. We are very happy with Valeria and her team that came out here from Boston in August to present it to us. And so to Kent, who originally scouted this one for us, and Kristen, who jumped on, please join me with a drink from the Deal Bar. We toast the success of your ventures. May they grow and exit. Cheers. You too can get a coveted shot from the deal bottle. Guess how? And again, apologies for running a little bit over. I really wanted to show you GripFusion. That's our 2025 September program. Please stick around, and definitely presenters stick around. This is your moment to ask all the really hard questions that you didn't want to say in public. Until October 15th, we stand adjourned.